Hey y'all, welcome to my channel. I'm Elena Raquel. It is no secret that I have anxiety, and when it comes to my academic life, there is no exception to that. So in this video, I'm going to discuss a little bit of the intersection between anxiety and school, specifically performance anxiety in ultrasound school and how I manage that. So one of the things that gives me anxiety about ultrasound school is taking exams. They are hard. It's a lot of material to cover. The first thing to do, of course, is to be prepared. Make sure that you know that material back and forth, that you dedicate enough time to studying, that you're not waiting to the last minute, the night before, and just brain dumping when you get to the exam. If you need to put it on your calendar when you're going to study, do that and make sure that you stick to that schedule. Also, you want to sleep. I know that being anxious can cause you to freeze when you're studying for exams. So you want to stay up and just study, 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 or your mind is just kind of going. You're so worried that you can't get to sleep. Well, if you take a sleep aid like melatonin, I would suggest doing that. Or if you need to read a book, watch some TV to quiet your mind and get yourself just calmed down and relaxed so you can sleep. Do that, because when you get to the test the next day, if you're not functioning like you normally would had you slept, you're going to misread questions. You're going to just want it to be over and you're not going to do your best. Also, have a pre-exam routine or ritual, something that you do before every exam. I know one thing I like to do is I have a song or a couple of songs that I might choose from and listen to that to just get me into the beast mode, like I got this exam type thing. Or if you need to meditate, do that, whether it's in your car, while you're driving to your exam, or do yoga before you get in your car and go to your exam. Whatever that is for you that helps to calm you down and relieve a little bit of that stress and test taking anxiety. Another thing that causes me anxiety in ultrasound school is the ultrasound techs watching me scan. I hate being watched doing anything. So scanning is no exception. But remember, they've been where you've been. They were students at one point and they want to make you better. So just focus and practice being in the moment. Like I said before, meditate. And if you meditate before, make it a common part of your everyday routine, your mind will automatically, hopefully, go back to that mindset when you're in the moment scanning. Adopt a mantra. My mantra for ultrasound and scanning is she believed she could, so she did. And so when I get in there and I feel like I just can't find whatever I'm looking for or I'm taking too long, I start getting frustrated with myself. I repeat that in my head. She believed she could, so she did. She believed she could, so she did. And that honestly helps to calm me down and help me stay grounded and in the moment. Also, performing checkoffs in class or competencies in clinic is also a major source of anxiety for me in ultrasound school. But just remember, it's not going to be perfect. Just do your best. And the perfectionist in me doesn't want to say that, but it's so true. Another thing I do while I'm doing checkoffs or while I'm out doing competencies in clinic is I hear the voice of my instructor in my head. She's telling me, adjust your depth, adjust your gain, adjust your TGCs, turn your hand, rock it, 10 o'clock. I hear her talking to me. So whether it's your instructor or some other positive voice, replay that in your head while you're scanning. One piece of advice that a tech gave me while I was out in clinic, she said, Elena, you know what your problem is? You lack confidence. What I want you to do is have false confidence. So basically this fake it until you make it type attitude. Go in there and say, I got this. Don't defeat yourself in your mind before you even get to that exam. Speaking of competencies, getting all the competencies that you need for the semester might also give you some anxiety. You may have 30 competencies that you need, and it's the end of the semester and you've only got half of them. Well, don't wait till the last minute to start getting your competencies thinking, oh, I'll get it later. I don't feel like scanning today. Another one will come by. That patient looks too difficult to scan. No, you need to be scanning whenever you can and start early. Ask to scan. If the tech says no, they say no. That's the worst that they can say, but they want you to scan. It might be that they're too busy or they need to scan that patient for some reason or another. So make sure you utilize your time wisely and that you ask to scan. And they're going to be more willing to help you if they see that you're willing to put forth the effort to try. And everyone wants you to graduate. You want to graduate, your teachers want you to graduate, it looks good on them, it looks good on the school. The techs out in the field want you to graduate because they want you to come and work. They may be short-handed and they're waiting on you to graduate to say, hey, like, do you like it here? Do you like us? We like you, whatever. Can you scan? We'll hire you. Also, another thing, and the last thing that I'll talk about in this video is assisting with procedures. And my first tip for managing your anxiety as it relates to assisting with procedures is to learn by watching. Watch first. Don't just dive in there and think you got this or have them walk you through it. I learn by doing, but I think that in this case, kind of stepping back and observing, and you can be an active observer. You can hold the patient's hand while this is going on, but also be watching what the tech is doing as the procedure is occurring. If you got to set up a sterile tray, which you'll have to do for a procedure, take a picture of it when you're done. Review the picture, study the picture, figure out what goes where, how they like things done, and take notes. Which radiologist likes which needle? Where do they like their instrument set up on the tray? Ask questions if you're unsure. When I did a thyroid biopsy one time, I was in charge of doing the slides, and I hadn't done that before. I had set up the tray. I had controlled the machine for the radiologist as he scanned the thyroid, but I had not actually taken the specimen and put it on the slide and all of that. So I made sure that I got all my questions related to that out of the way before the radiologist ever entered the room. And lastly, if you're going to take your procedure tray and your machine to the patient's room versus having them come to you, make sure you have more than enough supplies. You may run out of something and you're probably going to need more gel. Make sure you have extra specimen cups, extra ChloraPrep, extra needles, whatever it is. Make sure that you bring more than what you need, because you would hate to have to stop or have to have the radiologist wait while you run wherever you need to run to get whatever you need to get. So just be overly prepared, especially if you're going outside of the ultrasound department to perform a procedure. That's all I got for you today. Is there something in particular that makes you anxious about school? Is there something that you want me to talk about or that you have a question about? Drop me a comment down below. Give this video a like and subscribe to my channel. Thank you for watching. Until next time.